Good day, class. In this video, we are going to study the etiological factors differentiation. From this video and the next session, etiological factors and the disease nature. These two are actually quite similar, although our textbooks separate them into two chapters. These two differentiation methods, we actually try to identify what's the pathogen, what's the cause of these symptoms. From the 8 principles differentiation method, we have studied that the cold, heat, excess or deficiency, yin or yang, exterior or interior. So from the 8 principles, when we see a patient, we have a general idea what category the symptoms falls in, either exterior or interior, or a cold syndrome, or the combination of some of them. But from the 8 principles, the differentiation methods did not tell us what exactly the pathogen is. It just give us a very general, vague idea of the pathogen. What's the nature or what's the property of the pathogens? But when you ask what exactly they are, because I want to know what's the etiological factors, what cause the disease, because in the treatment we're going to reduce or we're going to relieve or alleviate the etiological factors, the, the, the pathogens, such as someone suffer from the wind pathogen or the dampness pathogen. In our treatments, we need to remove or we need to reduce these factors. That's how to heal. So from this video, we're going to study how to identify which pathogens affecting the patient. Again, when we talk about the etiological factors, we have studied these etiological factors in the basic theory. So we knew that such as the 6 esogenous pathogens, the pathogen qi, the internal evils, or the emotions, all can affect our health. But when we study the etiological factors now, when we try to identify the etiological factors, can you show me the same question? Can you show me these etiological factors? Can you show me the coldness, the dryness, or the dampness, even the summer heat? Can you show me these factors? The answer is no, we cannot. But how do you know if you can't see these factors? How do you know these are the actual cause for these diseases? The reason is we can see the reflection after the pathogen attack. So we're going to see the reflection from the patient, what kinds of manifestations the patient has, and these manifestations can fall in which category. That's how we identify the different factors. So firstly, what are 6 exogenous pathogens? The wind, the cold, the summer heat, dampness, dryness, and fire are called the 6 qi. And the pathogen qi or epidemics that have contagious ability, rapid transmission, that's called the pathogen qi. So these two the exogenous pathogens, although they are different. The question here is the 6 qi and the 6 exogenous pathogens. What's the difference between these two? When I show this slide to some students, there are some students that they study quite well, so they remember all these different terms: the wind, the cold, the summer heat, and then they raised a question. They said, "Hey, Doctor Who, you make a mistake. You mistake. These are not 6 qi. These are the 6 exogenous pathogens." Then this is a very good question. What's the difference between the 6 qi and the 6 exogenous pathogens? The 6 exogenous pathogens are also the wind, cold, summer heat, dampness, dryness, and fire. So these two, from the tones, from the names, are exactly the same. The only difference is whether or not these items, these stuff, can cause diseases or not. If they cannot cause disease, they are normal in the environment. We call the 6 qi. If these cause diseases on individuals, then we call exogenous pathogens, which means these 6 things or 6 wind, cold, summer heat, dampness, dryness, and fire we can see in our normal environment. So every day in the nature around us, we can feel or we can see all these aspects in the environment. If these environments didn't cause disease on human body, that's the normal environment, normal factors in the environment that's going to balance the environment. That's once they cause disease, we call the 6 exogenous pathogens. So for instance, you can imagine that you and your friends have a party at someone's house, and then the second day, one of you got flu because the nights the previous night he was stay outside, and then he got the flu symptom, runny nose, headache. But at the same time, you were talking to the friends at that night, but you are fine in the second day. So here, your friends, you and your friends stay in the same environment. You you were experiencing the same wind or the cold at night, the same, but your friends got sick the next morning, but you are fine. So in this condition, when we talk about your friend's problem, someone was sick, your friend's problem, because that he was attacked by the wind and the cold pathogens. So that's from the 6 exogenous pathogens. But when we talk about you, you also said that that night it was a bit cold and windy, but the cold and wind is 6 qi, because these two did not cause disease on you, but the one causes disease on your friends is called exogenous pathogens. So I hope you will be clear to these terms from this example. The pathogenic wind syndrome. The pathogenic wind, which means the wind has caused problems in human body. And when we study the wind, we need to think about what the characteristics does the wind have. That's the only way how we identify. The wind is a young pathogen. A young pathogen can attack or more likely to attack the young parts of the body. Where's the young part of the body? That's the top part of the body, which can be the head, the neck, the shoulders. Or it also can be the superficial parts of the body, such as the skin. The wind also has the characteristic of migration. It can move here and there. That's what you can see from the environment. The wind, they can move. So the migration also can be a characteristics from the wind symptoms. So as you can see from the signs and symptoms from the wind syndrome, most of the symptoms can be caused by these characteristics, such as aversion to wind because they suffer from wind, mild fever, sweating or mild sweating. Why the patient will present with sweating? Because when the wind attacks the superficial body, attack the skin, the wind will open the pores. That's how the wind can cause sweating, headache, because the wind can go to the upper part of the body, sneezing, scratching throats, cough, as the wind affects the lung. The tongue coating is thin white. Can the tongue coating be thin and yellow? The answer is yes. So here we just give you the examples. It can be yellow or thin yellow or thin white. It depends on wind cold or wind heat. The pulse is superficial. So superficial, as you can see, the wind attacks the human body from the superficial, from the mouth and nose, from the skin. It's all superficial. The wind, also a young pathogen, also goes to the superficial parts of the body because the superficial parts of the body is the young parts of the body. The patient also can have itching on the skin. Urticaria that comes and goes. Urticaria is a kind of a skin disorder. You can see that it happens, it comes and goes. The action of comes and goes is a kind of migration. That something's moving. Facial puffiness. So it's a kind of edema on the face. Why on the face? It's also the top part of the body. Deviation of the mouth. Deviation is something moving. And then the migratory joint pain may be present. So in this condition, the patient will tell you they feel the joint pains in one joint today. The second day, the pain moved to the other joint, or yesterday it was the other joints as well. So the patient can experience the migratory pain in different joints. These are all the characteristics of the wind. When we talk about the wind syndrome, we need to identify the signs and symptoms. We also need to think about what's the cause, or what can be the cause of these pathogens. The wind can be the exogenous pathogens, can come from the nature externally. It also can be internal wind. So that's from the 5 internal evils. The internal wind, such as the extreme heat, insufficiency cause hyperactive young, or insufficiency, blood deficiency. This all can result in the internal wind. So that's the cause. The wind also have a characteristics of it's very easy to combine with the other pathogens. So that's one of the characteristics of the wind. If you don't remember, please go back to the basic theory when we talk about the pathological factors, especially in the wind session, in the 6 esogenous pathogen. It will help you to understand better for these symptoms. Because the wind can combine with the other pathogens, such as the cold, the heat, the fire, the dampness, the flame, the water retention, and toxic. So all kinds of other pathogens the wind can combine with. The key points of the wind syndrome is aversion to wind, mild fever, sweating, floating pulse. So floating pulse is very important. The patient may present with itchy skin or the other kinds of skin disorder, migratory joints pain. So these are the characteristics of the wind syndrome. When we study a new syndrome, we need to remember the manifestations. We need to think about what's the cause, what may be the cause of these syndromes. And we also need to try to learn how to analyze from the theories to explain these symptoms. So as you study, as you watch the videos, you will learn gradually how to explain these different symptoms. These symptoms links to which characteristics of the characteristics of the pathogen, such as the from here deviation of the mouth or the urticaria, the itching skin. These are linked to the characteristics of moving or migration, the wind characteristic. So you can find other characteristics according to the wind characteristic. So that's how to identify which pathogen the patient is suffered from. The cold syndrome. A cold syndrome manifests as the cold pathogen attack the body. So when the cold pathogen attacks the body, what's the result? The result is the yang qi of our body, the anti-pathogenic qi, the parts of the yang qi will be affected. So when the yang qi be affected, we will not have enough yang qi, which also will result in a cold syndrome. So a cold syndrome can present as the aversion to cold, no sweat. Why there's no sweat? That's because in the cold condition, everything contracted. The pores also contracted. So it's kind of closing the pores. So why there's no sweat. The patient may present with body ache or chest pain, abdominal pain, different kinds of pain. The reason is the cold pathogen can slow down the circulation, can block the meridian, and then it will cause lack of nourishment or blockage. So when we talk about the pains, we mentioned that the two very important causes of the pain is the blockage and lack of nourishment. So the cold pathogen can result in these two. The coating of the tongue is white. It must be white because the white coating is the The white color is the characteristic of cold. The pulse can be wiry and tense. You still remember the tense pulse. So how we analyze the tense pulse? That's also due to the cold condition. It is kind of contraction of the muscle or kind of the spasm of the vessel. So the spasm is with the quotation mark. So the signs and symptoms: severe chills, mild fever, no sweat, joints pains, body ache, that's all due to the blockage and lack of nourishment of in the meridian or organs. The patient also can present with cold lumps, cold pain. A cold pain means the pain can be relieved by warmth. Diarrhea is the coldness in the spleen. Vomiting is the coldness in the stomach. Coughing with a white phlegm, so the color is very important. It will never be a yellow sticky phlegm. It is a white phlegm. Pale complexion. A tense, slow pulse. So these are some of the manifestations of the cold syndrome. So it generally cold hands and feet. So that's also a cold manifestations. Pain with a fixed location, severe pain. This is actually a combination of the cold and blood stasis, because the cold will slow down the circulation and will cause blood stasis. This kind of characteristic can be the characteristic of the blood stasis. In large town, that's the water retention, pale, cold. So the key points for cold syndrome is the cold characteristic, no sweat because the pulse was contracted. It can be aggravated by the cold and alleviated by warmth. Then what can be the cause, or what can be the possible cause of a cold syndrome? So patient attacked by the cold, what kinds of situation is considered as attacked or attacking by the cold? Such as if you stay in a cold weather or in a cold environment for long, or there's a hailstorm when you go back to your house and then you didn't bring any umbrella, so you were in the rain for a long time and feel cold. Or someone they work in the supermarket in the food, especially for the meat area. In the environment is always with ice and fridge or even freezer. So that's from environment, from the career. Also can be the cold condition, also can be the food. So someone they like sushi. They like sushi. They eat sushi every day. The sushi, the raw fish, the raw fruit, raw fish. And more commonly, especially in South Africa, the locals, you guys like the cold drink, the ice cold drink, something from fridge. You drink ice cold water. So these are all the possible causes of a cold syndrome, from the diet, from the environment, from the occupation. So that's something we can try to avoid, or we can try to, if we see a patient with these manifestations, these are some aspects that you can think of. That's how you can help them, to relieve the the symptoms. How can you help them to heal and to prevent it happens again? Because these either from environments or from the lifestyle, from the diet, this is going to affect the human body. This coldness also going to affect the yang qi of the body. In this video, we have introduced a wind pathogen and a cold pathogen. We have introduced a wind syndrome and a cold syndrome. So in our daily practice or in our daily life, try to identify some of the phenomena in our daily around you and try to analyze. In this way, we use the basic theory to analyze the phenomena around you. That's how to practice the way of thinking. We study Chinese medicine and acupuncture, especially from the theory. We study the Chinese medicine and acupuncture. We focus on human being. We are human being. We focus on human beings' diseases. So we actually can study on ourselves. We use ourselves. We use your family. You're going to use your families, your friends as an example to study the theory. Find some components from your family, some components from your friends. You try to identify what's the cause of these complaints. Try to analyze with the basic theory. And also, if you identify the actual cause, then you can think about what's the solution. Such as here, if someone suffers from a cold syndrome, then you identify as a cold pathogen, then you can think about how to reduce the cold pathogen from either from the treatments, from lifestyle, from diet. That's how to help them or help someone else. In the next video, we are going to continue the discussion on the etiological factors on the summer heat, dampness, and others. Thank you for your attention.